Baby comes home, you have so many things to worry about. Their health and well-being is number one in your whirl of things to worry about, and you are responsible for everything that happens to them. And things happen unexpectedly. Everybody wants the best for their child. You just spent 10 months taking care of this baby while they're in your womb. Now you bring them home and things happen, but if you could prevent it, that you just want to maximize prevention from anything happen. So sudden unexpected infant death happens. Of the deaths that happen, 4,000 of them happen from SUID, which is sudden unexpected infant death. 50% of these are classified as SIDS, so that's sudden infant death syndrome. Ways to prevent SIDS: you can place your baby, you should place your baby on their back. Do not place them on their belly. Do not place them on their side. Place them on their back on a firm mattress, bassinet. And when I say mattress, I'm talking about a mattress in the crib, not in your bed. They should be sleeping in their own compartment. So if it could be a box, it could be a bassinet, it could be their crib. They need to have their own space where they're sleeping. You're not co-sleeping with baby when baby first comes home. Absolutely not. Their space that they're sleeping in has basically just a fitted sheet if it's a crib. No bumpers, no stuffed animals, no blankets. You dress them comfortably enough for the temperature, like how you would dress yourself. And the rule of thumb is basically like they should have like one extra layer than you. What I find with my baby, he pretty much dresses pretty much like me. When I tried to put more clothes on him, I noticed he was more restless. So you dress them comfortably for how you would dress yourself, pretty much. You place them on their back. You place them on a firm space. You do not sleep with them in the same, they're not sleeping in your bed. To also prevent SIDS, you should, for the first couple of months, maybe up to a year, have them be sleeping in the same room as you. So having their crib or their bassinet in your room, or vice versa, you're going into their room. Since the American Association of Pediatrics recommended placing babies on back, they have seen a decrease of SIDS, but they've seen an increase of other sleep-related deaths, including suffocation and entrapment. So it's really important for them to have their own area where they're sleeping. And that's why like a baby box is great if you can't afford a bassinet or a crib or a rock and play right away. Breastfeeding has also been shown to decrease SIDS. You could also use a pacifier. Do not force the pacifier in the baby's throat if they don't want it. If they spit it out, that's fine. You want to keep up to date on your well visits with the doctor, along with immunization. That's also been shown to decrease SIDS. Some warning signs that you should look out for when it comes to like SIDS or sudden unexpected infant death. If their color changes, blue, pale, yellow, those are all warning signs that something happened. Contact a health provider or 911 right away. If they're refusing to eat, they have patches of white, you should contact your provider. If there's no stool for 48 hours or they don't have wet diapers, 6 wet diapers in 48 hours, contact your provider. Basically, that means like they're not drinking, they're not having enough milk, and they're most likely going to become dehydrated. If they have a high temperature of 100.4 Fahrenheit degrees or more, always have a thermometer. That should be the first thing that you have, like one of the first things you buy before you bring baby home. Have a baby thermometer. If they're vomiting, that means also like they're not able to like digest the milk, and that could cause dehydration. If they're crying excessively seems like a vague term, but if it's going on for quite some time, I would say like 15 minutes more, and then like you're not able to like, you've covered all the bases and they're still crying, you should probably contact a provider, especially in the first couple of weeks, first couple of months. Super important. They're extremely fussy. You find like an unusual rash. So like diaper rashes are common, but if you see rashes just like popping up that are places that you really wouldn't commonly see one, you should contact a provider. If you see frequent or excessive bowel fluid, mucus, or a foul odor, contact your provider. Signs of dehydration. So dehydration is so important because if you think about it, in the first couple of months, all they're doing is drinking milk. And so if they're dehydrated, they're not getting the nutrition that they need, and basically everything will escalate from there into becoming very severe. So when you see decreased wet diapers, irregular smell or color, dry or cracked lips, that's usually a first sign, even like in adults, like they're not having enough water. Dry skin or lethargic, they just don't seem really like aware of like what's happening, contact a provider. And we all want the best for our child. We're all doing the best for our child. So when you see anything that just raises a red flag, contact your provider. And if it's extreme, contact 911. Sometimes when you contact them, they'll tell you to contact 911 if it's really extreme. All right. And one other recommendation that I would make is definitely do baby CPR. I did it with my husband. We did HIMIC. I think it was the same class where they pretty much teach you for everybody from babies to adults. So I really recommend that. Even if you feel like, you know, you wouldn't feel comfortable doing this when the time comes, it's great to just know what should be done and the signs leading up to when you need to do these things.